Hey, Dr. Tyler Williams at Pinecrest Dental, and thanks for taking a minute to watch this video. You're here because you have some questions about teeth that are sensitive to cold. Maybe you had a tooth worked on at a dental appointment and it's sensitive to cold. Maybe you haven't been to the dentist for years and you just started noticing that when you drink cold water or certain foods, maybe ice cream, sometimes even warm foods, warm coffee, warm hot chocolate, warm soup, those kind of things, and it causes you to get a zing or an ache in your tooth. And I want you to know that you're not alone. There are millions and millions of people throughout the world who suffer with sensitivity to cold. And there are a number of reasons this happens, but if it's on a certain tooth, more than likely you've got a problem in that tooth. Now, if it was worked on recently, there's probably a gap or something that wasn't sealed up correctly, and that's causing the temperature issue. Often we get patients referred to us that have small cracks. We call them micro cracks in their teeth, and that's from a tooth being treated or taken care of incorrectly, and unfortunately that causes sensitivity. If you've had a crown or a root canal in a tooth and it's sensitive, this is one of the most common issues. Unfortunately, the way that most teeth are treated is far too aggressive, and we use something called a biomimetic approach, but it's a way that saves more of your tooth. We don't grind your tooth down to a little nub because that's counterproductive. Now, most dentists and dental professionals who do this are doing it with the right intention, because that's how we're trained, that's how we're taught in dental school. That's the method that's been around for hundreds of years, and it does work. The problem is, anywhere from 25 to 75% of people have sensitivity or cold, and that's because when these techniques were invented, that was the best technology, and it did help save teeth, and it still does help save teeth, but it can be very uncomfortable. And so as technology has evolved, we've come out with better and more perfected ways of treating your teeth to avoid sensitivity, and that's where the biomimetic approach comes in, and we use a system we call PRISM, and that is a way to save more of your tooth and avoid having to get aggressive crowns, 3 times less root canals, and your teeth are white, look great, they're shaped more like a natural tooth. And this isn't training that we receive in dental school, because there just isn't time. There's so much packed into 4 years that there's no time to learn this. And so this is things that we've learned and we've trained on and we've developed over the past 10 to 15 years, and it really, really helps thousands and thousands of people every year. And again, most professionals are really trying to help you, just that often the approaches are too antiquated, too old school, and there are better ways to do it now that we're trying to help more and more offices learn, more dentists learn about this, but we just can't get the message out fast enough. So if you haven't had work done and you're too sensitive to cold, there's probably a hole in your tooth or something exposed. That can be from a cavity, that can be from receding gums, that can be from a crack in your tooth. So when you have this treated, you want to look for someone who can treat it with a biomimetic approach, because if you go to just any regular dentist, they're going to probably suggest you get a crown and a root canal in the tooth. And I can't tell you how many hundreds and hundreds and hundreds of teeth we have saved and not had to put root canals, not to do root canals, not put crowns on. We feel better about it because our patients are more comfortable, and you'll feel better about it because you know that there's other options available than just getting a dental crown. So if you have further questions about this, you can call us or contact us at the information below. If you're looking for a consultation, we still have several available this month. They are becoming more limited on times and availability because my schedule fills up quick, but I'd love to meet with you. So please reach out to us, and look forward to meeting you in person and speaking with you so we can help you have a better smile and have your teeth feel great. Thanks for watching, and we'll see you on the next one.